A local lawmaker one step closer to adding a new qualifying condition for medical marijuana, autism. It's not among the conditions right now that qualify. News 5's DeLon Dillard has the latest on where that legislation stands and why one parent says it is needed.
At only 2 years old, in 2016, Jackson Carwile was diagnosed with autism, and the months and years after his diagnosis, his symptoms escalated.
It was like a snowball effect after his diagnosis: insomnia, self-injurious behavior. He had what was called silent seizures for a while.
But his mother, Tiffany, says the pills his doctors prescribed him made it worse.
My son at one point in time was to ingest about 300 pills a month, and he was only 5 years old. And every pill caused side effects that deemed more pills.
Carwile says there are several medical benefits from medical marijuana for people on the spectrum. A current UC San Diego study is looking at whether it can help those who struggle with explosive behaviors, rage, or self-injury like Jackson. It wasn't until 2019 that Tiffany says Jackson qualified for medical marijuana, but only because he was diagnosed with epilepsy.
The change in him is astounding. I was able to hear my son talk for the first time. I'm sorry. He tells me that he loves me. He tells me that he's happy. I've never had that before. My son was completely nonverbal before.
Epilepsy is among the 25 qualifying conditions for medical cannabis in Ohio. Autism isn't on that list. Tiffany has been working with State Representative Juanita Brent to change that. And just this week, a bill to make autism a qualifying condition just passed in the state's health committee.
This has been a bill that's been 3 years in the making. So even though people are seeing this is a victory right now, this is my second General Assembly for even introducing this bill.
Brent says it took a lot of education to get lawmakers on board, and she believes when it goes up for a House vote next week, it will pass. Tiffany is praying that it does, for the thousands of parents she knows personally.
My son's story is one story that echoes the sentiment of thousands of children in our state that are just like him, and families that are just like mine and that are suffering in silence, and a lot of them are afraid to speak out.
DeLon Dillard, News 5.
And then there's this. Today, the Ohio Pharmacy Board selected 73 candidates for medical marijuana licenses in the state using a lottery system. Our media partners at the Columbus Dispatch tell us there have been roughly 1,500 applicants. Cuyahoga County leads all other counties for applications, so the number of licenses in Ohio will grow to 130 with today's selections. We're expecting to learn more about exactly who made the list in the coming weeks.